again today. Dental medicine podcast show today. I have I am honored to have Dr. Jeffery host and Dr. Charo Duri on my podcast today. We are going to discuss about anything in dentistry, especially some of the technology that we have and some of the invention that Dr. Host have done for the dental community. So Dr. Host is the well-known dental educator. He lectures around nationwide and international wide, and he have also invented several techniques for dentistry that help your patient to have a great experience. He also sit in a board member of many company and help make dentistry better place. So Dr. Jeff Hoofs, thank you for joining the show today. I appreciate your time.
Great, thank you so much. I mean, I've had a long day already. So I started at 8 o'clock this morning and finished at 6:15 to get ready. So I'm still up from the day.
Awesome. Dr. Host, just to let you know that you graduated in 1978. That was when I was 4 years old. 4 years old. So it's an honor to have like an amazing doctor that still practicing, still teaching, still sharing the knowledge to generation after generation. This is so beautiful. So I'm so happy and so honored to have you.
Well, thank you so much for having me. I'm excited to talk with both of you.
And Charo is, many of you guys know he is the dental consultant. He's been practicing more than 20 years, and now he is full-time consultant for dental technology and startup company. So Charo, welcome as well.
Thank you so much. Always a pleasure. So love being surrounded by great minds. So I love to learn, and I'm honored and privileged to be here with Dr. Host, to be here to listen and observe and learn from his experiences and understand exactly where he's gone, where he's going, and what he's done, and how he's contributing to dentistry to change and make a great impact. So thank you so much for allowing us this opportunity. It's a privilege.
You're welcome.
Dr. Host, Charo, dad is the periodontist that still teaching at USC.
Almost 50 years, yeah.
Yes.
Yeah.
Wow. Good for him.
Yeah.
Wish him lots of years of good health.
Yes, exactly.
Dr. Host, first question we want to jump right in is, I know that people love to know your history. How did you become a dentist, and what made you choose dentistry as a career? I know this is a very common question, but your story is very unique, and I'd like to hear your sharing, please.
Sure. What's interesting about my story is my wife will tell you I'm going to be celebrating 47 years of amazing marriage. And, next month, or what am I talking about next month? In a few weeks. And my wife says that I'm the most self-actualized person you've ever met in your life, because I've wanted to be a dentist since I was 5 years old.
Wow.
And that sounds totally bizarre, but it's an absolute true story. And I love telling this story. I grew up in a little town in Maine called Old Town, Maine, which is 12 miles north of Bangor. And yes, there are people up there. And I grew up in a very small community. And my parents, what's interesting is that my father did not speak a word of English until he went to school. He was only speaking Yiddish, and my mother could speak Yiddish fluently also. He grew up in an Orthodox family, an Orthodox Jewish family, and they were very well-meaning people. They were educated, but dentally they were zero educated. And my mother was really someone called a Bangor bride. And it's really a terrible term, but my mother was missing most of her teeth because she grew up in a very poor family on a farm. Mm-hmm. And one evening we were visiting my grandmother, and I developed this terrible toothache. And I was 5 years old, and this was well before the age of cell phones. And my mother literally went to dentists' homes, because home offices were very common. And she banged on the door to say, my son has a terrible toothache. And we literally went to a dentist named Dr. Savage.
Wow, you still remember
That
that?
was
It's
actually
like Dr.
his
Payne.
name. That was actually his name. And I can remember as clear that we walked into this office that had that eugenol smell
Yeah.
and the green monster thing sitting next to the upright dental chair and the cabinet behind it with the needles hanging below, hanging down in the jars. And I had a horrendous dental experience.
Wow.
I was covered in blood. And my mother then decided, well, I got to start taking little Jeffrey to the dentist. And so when we went, of course, I was frightened out of my mind. And so, being a pretty smart little kid, I was able to make myself sick. And my mother would, who was a school teacher at the time, if I threw up on myself, she would just bring a change of clothes and bring me into the office. And of course, I'm certain that I was acting out. And finally, the dentist said, yeah, I can't treat him. So I win, right? I win.
Yes.
And then I developed another problem and she took me to another dentist. So, of course, I'm going to throw up, right? My mother brought a set of clothes. So then I figured out, well, if I go to the bathroom in my pants,
Oh,
it
jeez.
doesn't have another set of clothes. And so that's what I did. And again, I win. But one Sunday morning, we were at a bagel breakfast and I developed a horrendous toothache. And my father, who worked in a meat packing plant, had made friends with a young guy named Dr. Irving Paul, who has since passed away, who was a very well-known dentist in Bangor, Maine. He called Irving Paul on the phone and he met us at the office Sunday morning. Now, first thing you got to do is you got to throw up, right? Well, I decided I would go to the bathroom in my pants instead. But my father, being how he is, he said, took off my pants, took off my underwear, and literally wrapped newspaper around me with black electrical tape that he had in the car
Oh, geez.
and brought me into the office. So clearly, I went into the bathroom and I proceeded to throw up all over the bathroom. What's interesting is that Irving Paul opened the bathroom door and he sat down on the floor with me. And he said to me, essentially, I understand how you feel. I've felt that way too. But if you let me, I will try to help you. When we talk to patients, we need to use the phrase feel, felt, found.
Right.
I understand how you
Yeah.
feel.
Right.
I felt that way too. But then I found out, and he brought me into the operatory. He showed me the syringe.
Oh, geez.
He showed me the glass carpules. He let me keep a glass carpule. And I fell in love with Irving Paul.
Nice. Beautiful.
And so then what happened was when people would say to me, so little boy, what do you want to be? I'd go, I want to be a dentist, versus at that time being an astronaut, or that time being, something more exciting. I want to be a dentist. And so I have a cut and paste that I made in kindergarten of a dentist saying, I want to be a dentist. And my mother saved it. I still have it. And my whole school career was based on me becoming a dentist. What's interesting about this is that you have to remember that in 1957, when I was 5 years old, the world was a very different place. And grade school was very different. And what's interesting about this is that I have somewhat of a photographic memory. It's called a visual memory, But the truth of the matter is I have almost a zero auditory memory. And so for years, I was able to get by on my visual memory. Now, if you think about dentistry, what does that mean? If I can see it, I can make it. But if you're going to tell me about it, I cannot do it. And so what developed in college was very difficult for me because I had to develop methods and methods of teaching myself how to learn. And of course, if you found some of my notes from college, they're all in color, you know, and I can still see college notes. So when I first applied to dental school, all the guys from Vietnam were coming back and the competition was very tough. And I didn't get in. So here I am trying to be a dentist, becoming self-actualized. And my girlfriend at the time, Betsy, who became my wife, I was ready to give up. And she goes, no, we're not giving up. You've wanted to be this your whole life. So then after graduation and not getting in, I then went to this, I had a dental school interview. And what's interesting is that when I took the DATs, I got a perfect score on the visual, a perfect score on the visual, but a very poor score on the didactic. And that perfect score in the visual got me an interview at Tufts. And the guy said to me, we don't understand how you were able to do this. And so he gave me some additional tests. And I'm able to, and I'm one of these guys that can unravel the boxes and tell you what they are and see 3D, all that kind of stuff. So when it comes to doing implant dentistry or it comes to building things three-dimensionally, I can just see it. But he said, you don't have a good enough grades to get into dental school. I said, well, what do I do? He goes, you have to go get a master's. I said, I'll see you next year. So I took myself to the University of Bridgeport. I took myself into the dean's office and I said, I need to get a master's in a year. He said to me, you can't do it. I said, you outline the course, because all you have to do is say no to me. You outline the courses that I need to do and I'll do it. And so what happened was, his name was Michael Summers, and he took a real liking to me because I had developed some techniques related to some work that he was doing. And I got my master's in biology and did my orals the month before I went to dental school and entered dental school. What was interesting about dental school was that, of course, the didactics were very tough for me. And when I went to get tested, because I was so concerned, I just couldn't do the work. I couldn't keep up. And I met a guy named Forgione. And some of you who are listening to this podcast may remember him, but he was a psychologist at Tufts. And he said, you know, what's interesting about you is you have almost zero auditory memory. So if you spell any word to me above 5 letters, I cannot tell you the word. Can't do it. But you show me something and I can build it. And so I said, what am I going to do? He said, you're going to work very hard. You're going to get through the didactic. So I graduated at the bottom of my class in didactic and number 2 in clinical. Because once I saw someone do something, I can do it. So one of the goals of dental school was to develop a method to do painless injections. Yeah. And so one of the things that I'm known for is teaching people how to give painless injections without using topical. And many of you know who Woody Oakes is from the Profitable Dentist years ago. And one of the most successful videos we ever did, and one of the most successful courses I ever did, was teaching dentists how to do painless injections. And how that came about was I was teaching an implant course in Las Vegas with a good friend of mine named Joe Stephen, who has just passed away, who has recently passed away.
Sorry to hear that.
And I talk about building practices And the number one practice building technique that you can do is comfort care calls,
Absolutely.
calling your patients at night. And the number two technique is painless injections. So the guy in the front row says to his buddy, "That's impossible." So being the way I am, I stopped the course. And I said, "I got to ask you, why do you think it's impossible?" And of course he turned red, and, because I'm the guy giving the course. I said, "No, really, why do you think it's impossible?" He goes, "You cannot consistently give painless injections without using topical." So it was a 2-day course, and I said, "Does anyone practice in Las Vegas here?" And of course, a bunch of people did. I said, "You need to bring a syringe and some needles and some lidocaine or something, and at the end of tomorrow, I'll teach people how to give painless injections." So working for 2 days on implantology, and at the end of the second day, I'm pretty tired, and there were about 40, 50 people in the course, and they're all sort of standing around. And I said, "What's going on?" He said, "Well, you said you were going to teach us painless injections." I said, "Yeah, okay." So I said, the guy that said you couldn't do it, I said, "You have to be the patient, because if you could be a shill, I'll ask Joe Stephen to come over. He won't move. You could be a shill. You have to be the guy." He goes, "Yeah, okay, I'll be the guy." And so he sits down in a chair. I put on my gloves and I do some things. I say, "Take a deep breath, look at me," and I do my technique. And we're talking, and I take another deep breath. I take out the needle, and we're talking a little bit. He goes, "Jesus Christ." I said, "What's the matter?" He goes, "I didn't think you did anything. I literally did not think you did anything." So the painless injection technique is based on something that's very interesting. We have two nervous systems, the parasympathetic nervous system and the sympathetic nervous system. And when you have a patient that's in the office and you come into the operatory and they say, "I just want to go to the bathroom," that means that their sympathetic nervous system is taken over and they're nervous and they need to go to the bathroom. When the parasympathetic nervous system takes over, and the way to remember that is Papa will take care of you, they are very relaxed. They have no epinephrine on board. If you have somebody, they say, "I'm allergic to epinephrine." Well, no one is allergic to epinephrine. If you were, you would be dead. So what happens is when you give someone an injection and you put on some lidocaine with epinephrine and you add a little more epinephrine, their sympathetic nervous system gets kicked up and they become jittery. So the goal is to keep your patients as relaxed as possible. And the key to it is this, that you need to do 3 things. You need to know where you're going. You need to use an ultra sharp needle. The best needles on the market are made by a company called Transcodent, which is distributed in the United States, Transcodent needles. And if you contact them, they'll give you a box of needles for free. And if you use the code word giraffe, because I'm president of the Giraffe Society for people willing to stick their necks out, you will get a free box of needles. And their needles are ultra sharp. They're the sharpest needles on the market. And so when you have the patient open their mouth and you introduce the needle to the site, you do not move the needle to the site, you move the patient to the needle. And the way to prove that to yourself is if you take a piece of paper and you push a needle against it, the paper will go away. If you hold the needle steady and you bring the paper to the needle, it goes right through. So the stretch receptor of having the patient open, then you say, "Look at me." What you've done is you've instantaneously hypnotized that patient for a brief second. Take a deep breath. There's more information going into the brain. Moving the patient to the needle, they will feel nothing. They will feel absolutely nothing. So that's a technique I developed in dental school because giving painless injections is a great practice builder. And I used to do hypnosis in my practice. It takes too long
Yeah.
to do hypnotize people. And I was really good at it. I was giving a lecture in Australia in Sydney for a woman named Ruth Port. And someone asked me about the painless injection technique. And I was talking about hypnosis and how important it is to understand hypnosis. And the guy goes, "Do you still do hypnosis?" And I do. I said, "I do," but he goes, "Well, show us." And so basically I could used to be able to hypnotize 30 people at a time
Wow.
and make them make them stand up and bark like a dog and do crazy shit. But I don't do that anymore. The thing about hypnosis is hypnosis is you have to be very kind to people. What's funny about hypnosis is that people think, oh, you can teach hypnosis because you get people to do things they wouldn't do. And the answer is that's not true. If you watch a great hypnotist do a stage show, he'll do things like this. He'll actually wipe his face and he'll watch in the audience who wipes their face because they're very suggestive. And so those are the people he asks to come up on stage. So the painless injection technique really was a great practice builder. But the number one practice builder is comfort care calls. That anyone who is treated in my practice for years would get a call. And that started in dental school also, because my first dental patient, Mr. Larry Maher, who I gave my first injection to, my first amalgam, my first root canal, my first partial, the only reason I called him that night to see if he was alive, because I had never given an injection to anybody. And so at the end of the call, he said to me, "Jeffrey, I cannot tell you how much I appreciate this phone call. Don't ever change." And I thought to myself, wait a second. I need to call these patients at night to see how they're doing. And so every night I would call my patients who would get injections, check in with them. And then, of course, as dentistry became more sophisticated in my office, I would not do it just for simple things. But when I started doing implants many years ago or full mouth extractions, I would certainly call my patients. And what's very funny about patient care calls, a patient would say, "I was expecting your phone call and you didn't call me. What happens? I'm not good enough to get a phone call?" And so I suddenly realized that these comfort care calls were very time consuming. And it was easy when we started getting cell phones, and I would call on the way home but in the evening, it would take 45 minutes to an hour and a half to get through these because I have a very, very busy practice. So then I was introduced to something that is so amazing, and it's called automatic patient. I'm so tongue-tied. It's called APE-DENTAL.com. And I can share with you, I think, if I go here, let's see what I do. Share a screen. And if I go here, and I'm going to go share, it looks like this. So it's APE-DENTAL.com. And what it allows me to do is I get on my computer every night a list of patients. I'm able to communicate with those patients, and they think what I'm doing is I'm texting them. But in fact, what I'm doing is I'm doing it through my computer. And so now how do I unshare this?
You can just hit stop sharing.
Stop share. There it is. Stop share. So now APE-DENTAL.com allows me to communicate with my patients, and just this morning on the way into, when I got into work, I got an email from a patient. My husband, unfortunately, is under cancer care. Can you recommend a cancer doctor for him because he has this, this, and this? And I sit on the Smile Cancer Board at Yale. And so I said, no problem, because what it does is it builds the relationship with your patient.
Mm-hmm.
You've all heard the expression, they don't care how much you know.
Right.
They only care how much you care.
Mm-hmm.
Connection, right?
Connection. And so the connection with your patient is what builds your practice. And so when I started my practice in 1979 on a one-chair office on a second floor walk-up after being fired from 3 dental jobs
Uh-huh.
in 6 months.
Why?
3 dental jobs in 6 months. The first job, the patients were all asking for me because I was giving them painless injection. The older doctor couldn't stand it.
Uh-huh.
Another job, the guy was doing things in his practice that I thought were totally unethical. I'd see rampant decay and there'd be a gold onlay.
Uh-huh.
And number 3, the third guy was doing things that lots of dentists get involved with that I'm not interested in.
Right.
And so my wife said to me, I have had it. We need to open a dental practice. I said, how am I supposed to do that? I don't have any money. I don't have any money. And a very dear friend of mine who was an oral surgeon who recently passed away, Dr. Earl Slusky, said, I will go co-sign the note with you because you are a superstar.
Mm-hmm.
And I believe in you.
That's nice.
And he's the one that taught me how to do APICOs. He's the one that taught me how to do extraction techniques that I didn't learn in dental school. He's the one that taught me how to manage patients with infection. And he became my dearest dental friend. And when I started doing TMD therapy, he didn't want to do that. And literally someone would show up in my office who needed to be seen. And I could call him on the phone and say, I have a patient that needs this. We had an amazing working relationship. And I miss him very much to this day. But it is that relationship you have with your patient, that they believe that they're the most important person in the world while you're treating them. That's how to build a dental practice. And artificial intelligence, or what I would call technology, high tech, allowing you to have high touch.
I like that.
Using high tech to have high touch. And so here, there are now 4 of us in the office. We're open 6 days a week, 4 evenings a week. We have a staff of 25. We have 6 full-time hygienists. There's a lot going on.
Mm-hmm.
You cannot do that with an analog business. You must use technology to do that.
Yes, I agree. So, Dr. Host, can you tell us more about what can the app do for the patient, like communications, texting, sharing, and what else the app can do for the office, especially.
So what the app actually does is it allows it actually is able to go into your software,
Mm-hmm.
glean tremendous amounts of information. The gentleman that Dr. Corwin, who developed it, worked for a DSO.
Mm-hmm.
It allows you to monitor what your doctors are doing.
Mm-hmm.
It allows your front desk behind the scenes to actually see what doctors are doing and how they're communicating with their patients.
Mm-hmm.
With a touch of a button, you can send out reminders to your hygienists or your hygiene practice, literally reactivate patients. You can monitor what's happening with your accounts receivable in a real time.
Mm.
And so there are many things it can do. But the other interesting thing it can do, if you look at, we have, I don't know, 500 Google reviews.
Mm-hmm.
What happens is it allows patients to Google review you.
Oh, wow.
and it allows you to interface with those
Yes.
patients. So it is absolutely amazing. Now, that's not to say there aren't other programs that do this.
Yeah.
There are. But what Dr. Kerwin is able to do, because he's a dentist
Mm-hmm.
who is a software engineer, developer,
Yeah.
he's able to glean this based on dentistry.
Cool. That's right.
Does it allow for direct with the Google connection part? Does it allow for direct without having to sign up or anything like sign in?
Ask me the question again.
Does it allow for direct contact to Google without Gmail without having to sign in?
You don't have to sign in. You do not have to sign into Google because you are communicating with their text. Therefore, they think they're texting you, but I'm viewing it on my computer.
Okay.
So take a look.
Right.
I mean, really, and it's inexpensive. It's like, I don't know, $399 a month or $329. I don't even know how much it is.
Mm-hmm.
But I have to tell you that the interface, Dr. Hoos, thank you so much for checking on me.
Mm-hmm.
And the other thing it allows you to do is I already know who my patients are, my new patients are tomorrow.
Mm-hmm.
So I'm able to interface with my new patients tomorrow. Hi, this is Dr. Jeffery Hoos. If you have any questions about your appointment tomorrow, please let me know.
Mm-hmm.
Sometimes, what are we going to be doing tomorrow? Or I get nothing. But the difference is when I walk into the operatory, hi, how are you? I'm Dr. Hoos. And that's a very important nuance. All doctors are called by doctor.
Mm-hmm.
It's Dr. Hoos, it's Dr. Zitning, it's Dr. Qualick, it's Dr. Latham, it's Dr. Corum. Because Dr. Corwin is a doctor. Some people will say, hey, I'm Dr. J, hey, I'm this, but I'm not Jeffrey. I am a doctor. I had an interesting experience happen in Ireland. I was giving a lecture in Dublin and I said, so how many of you are doctors here? Now, one person raised their hand. I go, wait. Tell me, how many are dentists here? They all raise their hand. I go, let's get something straight. When someone comes in with a facial swelling and they need an IND and they need a tooth removed, are you going to do that? Or is a physician going to do that? We're going to do it. You're doctors. You find cancer, you save people's lives, you do lots of things. I mean, I must have found 25 cases of melanoma over my career. Squamous cell carcinoma in people's mouths. Other bizarre things. Now that we have cone beams, we see lots of things we need to know about. We are doctors of the mouth. When I was having my dental school interview, the guy said to me, which was very common in the 70s, people were applying to dental school because they didn't get into medical school. He said, how come you don't want to be a physician? How come you don't want to be a doctor? I said, what are you talking about? I do want to be a doctor. I've wanted to be a dentist since I was 5 years old.
Yeah.
Idiot.
Yeah.
And what was interesting, this guy's name was Dr. Junta. He was an oral pathologist. And I brought my research that I had done for my orals that were coming up. He said, what do you got there? I said, I want to show you the research I've done. He's looking at it. He goes, you can't make this conclusion from this research. I go, what are you talking about? My orals are next week. My thesis is done. So 3 years later, when in an oral path class, I went up to him, I said, Dr. Junta. He goes, yeah, you're the guy that found the proprioceptor in teleos fish. I was just trying to bust your balls. So automated patient experience, extremely critical in practice development.
I agree. It's Dr. Hoos, it's beautiful that in your conversation, it seems like you have a very amazing memory that you remember every single person that you encounter, especially even when you were young. That's I wouldn't remember my teacher or my doctor, but you remember at the early age, and several other people that you encounter. That is
So you want to know the trick? Do you want to know how the trick to
Please.
do that?
Please.
First of all, when you meet someone,
Mm-hmm.
you need to repeat their name
Mm-hmm.
to yourself.
Mm-hmm.
Number two, you need to associate their face with something
Right.
as a visual.
Long-term memory.
And what you're doing is you're embedding an engram in your brain as to what you're doing. So I can do crazy shit.
Mm-hmm.
Don't be offended by that word. I can tell you things about movies. I can tell you a story about Swiss Family Robinson that I saw when I was eight years old. I can tell you things about that movie that would astound you. But I can't tell you anything about the dialogue. And when I lecture, all I have to do is see the picture, and I can tell you everything you need to know about that case.
Mm.
About 3 weeks ago, I had a physician, an oral pathologist, come to my office with a very interesting leukoplakia-looking thing that he was very, very concerned about. And I said to one of my, and so I have very interesting dental assistants. One of my dental assistants is a dentist from Syria. One of my dental assistants is a certified dental technician from Bosnia. One of my other dental assistants was a dentist in Santo Domingo. I have an amazing staff. So I said to Kevin, who's the dentist from Syria, I said, go downstairs to my office. On the shelf, the third book from the left is a red book. Bring that to me and turn to chapter about 7 or 8, and you're going to see a picture of this on the left-hand side. So he brings up an old oral path book.
Mm-hmm.
Open up the page. There it is. Now,
Yeah, you have amazing memory.
so it's an interesting memory, but it's also being very handicapped because when my dental hygienist comes in and says, hygiene check room 3, then unless she leaves a sticky note, it's gone.
That's interesting.
It's gone.
Wow.
It's gone.
So,
And so when you understand your limitations, to this day, I say to my wife, how do you spell this? And she jokes, the only reason you keep me around is I'm a perfect speller.
huh.
And so it's an interesting gift that I have, but I also have a great deficit. So therefore, when I am running a meeting or I'm teaching or I'm in a different situation, I am constantly writing on a pad little visual cues so I know where I'm going. And so now I have in my office a device called XNav from the ICAT people.
Yeah.
Can you imagine how an amazing technique or technology that is for me?
Mm-hmm.
That I can watch what I'm doing 3D wise.
Yeah.
But what's interesting is that I can also parallel 4 implants by hand because I can just see it. I can just see it.
So you're talking about mental projection. I was a neuroscience major, by the way, in undergrad. And so one of my favorite classes was, I took upper division biology and upper division psychology. And one of my favorite classes was psycholinguistics, the study of language. And one of the things we studied, and the thing that came to my mind was what you're talking about, is connecting the dots from visualizations by taking things in memory. And what I learned is that if you take something and you put it into a word associated with a long-term memory that you have in your mind, whatever the word is, the mnemonic device, for example, right? And you take that and you put it into long-term memory, it's easier to remember because you've tapped into your database. It's a long-term memory to activate the short-term memory. And for me, that was extremely helpful for college and graduate school. So I use that technique all the way through school.
Excuse me for 1 second. I
Yeah.
cannot do that. Yeah, I cannot. I'm still doing this and I have to, okay.
So
Sorry.
no problem, but that's what you described, in that sense, right? And I've only met one other person that has really a photographic memory, actually maybe two, and in dental school, and both were valedictorian. One was valedictorian, the other one was pretty high up, and one of the youngest guys to graduate our class. And I would ask him certain pages in a book, and he'd go to the page, and sure enough, he'd be reading off the book on the page.
But
exactly where it was.
I can't do that.
Yeah,
I cannot do that. It's really more of a visual recall. So I can't memorize phone books and I can't, but what I can do is, for some reason, I can see things in a very spatial way. And my daughter has it also. Like I carry with me a puzzle ring. I have a puzzle ring. It's easy. And I hand it to people. Can you do this ring? They go, no, I can't do this ring. It's easy.
you like Rubik's cubes?
Yeah, Rubik's cubes are pretty interesting. They're pretty easy to master, but not to master at speed for me. I'm not willing to put the effort in. I'm not willing to put the effort in at all. Excuse me for 1 second.
Did you reach Jay Sakala?
Yes. No, excuse me. The answer is I did not.
Okay.
Sorry.
No problem.
Can you cut that out of the video?
That adds some character to it, though. That's
Well,
real
what
life.
happens is,
That's real life.
what's interesting is I'm happen to be chairman. I'm the past chairman of the Jewish Federation of Greater New Haven, and I'm chairman of the nominating committee. And they are trying to figure out nominations, and so they want my input. They have to wait.
Right. Right.
It's all part of, every article that I've ever written. I do a monthly column now for Dental Economics.
Yeah, you told me that. That's fantastic.
And it's called Practice Building 101, Balancing the Art, Science, and Business of Dentistry. We can do the most beautiful dentistry in the world. You can make a tooth out of soap, carve it perfectly. That's bad science. And it's also bad business. Doesn't taste good and won't last. You can make a front crown out of titanium that will last forever based on good science and cement it on with Panavia, and it'll never come off. Not very artful, is it?
No.
And bad for business.
Right.
Who did that black crown for you? Oh, well, it will last forever. Well, you look ugly. And you can try to do things as fast as you want and rip through them and make lots of money and keep your overhead down, but ultimately you'll fail.
Right.
So doing beautiful dentistry based on great science with business in mind, that's how you maintain the balance. Thinking of a three-legged
That's a three-legged chair, though. What's the fourth legged chair? Connection?
Chair. So what happens is you take away this chair, you fall over. This
Right.
leg, you fall over.
Right.
You take away this leg, you fall over.
Right.
Take away this leg, you fall over. It's constantly balancing correctly.
So is the fourth,
And that's
fourth
why
leg connection?
there's no fourth, you don't need it. All you need is 3 legs. All you need is 3 legs.
Four's better.
But if you get out of balance, it's really a problem. It's really a problem. There was a time that I was in my life as I was a little out of balance. I could do 100 push-ups, and I was becoming more interested in that than I was what was important. And I broke my collarbone and I was out of work for 4 months. And that brought me back into balance. That brought me back into balance. And I have a great partner. My partner in life is keeping me in balance. Here I am, I'm going to be 70 years old soon. And I work as hard as anyone possibly can in dentistry. It's not a particular brag to say, I had a $35,000 day. Yeah, okay. But how did you accomplish that? What system did you use to do that? How did you maintain the balance in your office? What were you doing to be able to provide that dentistry in the most painless way for that patient and maintaining your health doing it. That's key. That's key.
Mm-hmm.
So,
Do you use a buffered anesthetic?
Sorry?
Do you use a buffered anesthetic?
I don't believe in it.
You use
You know
Septicant?
why? I
Why?
use Septicant, but do you know why I don't use buffered anesthetic?
Why?
I need the time. One of the worst things that happened when digital x-rays came out made everything much faster, right?
Yeah.
I used to love to be able to do, when I was doing a root canal, have someone take an x-ray and have 6 or 7 minutes to go do a hygiene check. So we have 4 or 5 hygienists working all the time. I need to be able to balance my time with my patients. So I don't need rapid on anesthetic.
Okay.
Well, not just rapid, but also effectiveness too. But yeah, that's another situation.
I just don't need it. And what's interesting is there's a new product coming out that will be even easier to do when it comes to using buffered anesthetic.
Yeah. There's quite a
Pretty
few.
exciting. That doesn't mean that sometimes I don't want to have rapid on anesthetic and do something really quickly. But the truth of the matter is, for me, I don't find it a burden. If you're working on with one patient at a time, okay, I get it.
Dr. Hooch, you still involved with the
Septicane only?
You're
Do you use
both talking.
Septicane only?
No, I don't use Septicane only. Septicane is very interesting anesthetic. Articaine, what is the concentration of articaine?
4%.
4%. What's the concentration of sentinous plane?
Right.
4%. Do you remember that in LD 50s, lethal dose 50s, that the higher the concentration, the greater toxicity?
Mhm.
Correct.
Remember that?
Yeah.
Right? If you have a blonde, thin woman and you give a mental block or a palatal using Septicane, you're going to have tissue sloughing many times.
Can. Yes, absolutely. I've seen it.
Okay. Also, if you're doing lower anteriors doing Septicane and the anesthetic wears off, should you go back with Septicane again? You should not. You can use carbocaine or you can use lidocaine, but generally you should not go, because what happens is you build up tissue toxicity.
Right.
Can you give blocks with Septicane? True or false?
You can, but I don't normally.
But you can. Of
You
course
can.
you can.
But you have a higher
There
incidence of
is
paresthesia.
no higher incidence. There is no higher incidence of paresthesia with Septicane as related to sentinous plane.
No,
you
but
still
related to
have to
lidocaine there is.
Yeah, you still have to use good technique.
Mhm.
But there's a higher paresthesia rate with Septicane comparatively to lidocaine.
I respectfully disagree with you. Look at the literature and you'll see if you use a half a carpule of Septicane versus a full carpule, you do not. Look at the literature just a little bit. I believe, I can't cite the article, but you'll see that there's not. But I don't give Septicane blocks unless I have a very, very hot tooth.
Right.
Okay.
Right.
But you need to remember there's also a nerve that comes up from the ansa cervicalis to the cervical, to the lingual aspect. And so you could be drilling a tooth on tooth number 19, and suddenly the patient feels that. Jack Fromer in 1976 found an aberrant nerve that comes up at the lingual aspect. If you give a drop of lidocaine on the lingual aspect of number 19, it will no longer happen.
If there's not a higher incidence of Septicane paresthesia, why would you not give it?
Because the interesting thing is, that's a very interesting question. I didn't say I don't give it, but what ends up happening,
selectively.
I give it. And so if I pick up if you ask most dentists, what do you give for anesthetic in their practice? Most of them can't tell you. I ask in these painless injection courses all the time. I don't know, my dental assistant orders it. I guess I'm using lidocaine, or xylocaine, I guess I am. So what ends up happening is if I pick up an anesthetic of lidocaine and I have the patient open and I bring the patient, I get the duration I need from that and away I go. True or false, when you're doing implants, do you give blocks for lowers?
Not necessarily. No, yeah, you don't need to necessarily.
You don't need
You
to.
can
But
do
what's the reason?
locals.
What's the reason not to?
Well, because you know that you get response from the nerve. So if you're getting close to the nerve, you want to know that.
Right, exactly correct. So by its technique, but the interesting thing is, if you use Septicaine while you're doing implants on tooth number 19, sometimes you can get a false sense. Now, with guided surgery using an X-stab, it's not an issue anymore. And the rule in my office is no cone beam, no implant. No cone beam, no implant. And so today I did a consultation with someone, and it was interesting. She was told she could have 3 implants, 18, 19, and 20. I said, I'm sorry to tell you that you cannot, because she had a lingual cavity that was on the Panorex she brought, looked like he had miles of bone. On the cone beam, not so much there. So we have to do some augmentation on the buccal for her to be able to have this implant. So no cone beam, no implant.
Why? No, I don't mean to. I'm one that likes to discuss things.
I'm ready.
I used to teach local anesthesia. So also, but you mentioned Septicaine and Havacarp that it's okay, but not a full carp. So why is that?
Because of the amount you're delivering.
Right. So, like, are you familiar that there's possible like interdental papilla loss too with PDLs?
Oh yeah, you can never, ever, listen to me carefully, ladies and gentlemen. Do not, when you're doing anterior aesthetics, do not use Septicaine in the papilla, or you're going to get dreaded black triangle disease, especially on thin women.
Biotype.
Especially on thin women.
Biotype.
The phenotype.
Yeah.
Of biotype.
Yeah. Well, I had a hygienist that was taught in dental school. I won't name which school, but she said was taught in dental school to give Septicaine, Sidonest on the palate for palatal injections. And so when I came in, the patient had the entire palate. She was a dentist, but she was doing hygiene, and the entire palate was sloughed. All the tissue was gone completely, and all bone was exposed. And I asked her why, and she said, "Well, I was taught to do Septicaine." And I'm like, "That's a higher concentration. That's a higher toxicity." So she said, "Well, I was taught that was the way to do it." So,
what did you do to manage that patient?
I put them on saltwater rinses, some Paradex. I know the tissue migration could be hindered though from Paradex. We put some palatal stuff, some numbing agents that were numbing, lidocaine numbing percent. There is some, about dicyclonine, but I don't know whether or not that would have been okay or not. I didn't have that in my resource bin at that time. It healed. It heals fast. People heal fast. It migrates 2 millimeters a day or something like that.
Yeah.
There's a lot of healing though. I could have done a surgical stent. Looking in hindsight, I could have done like a surgical, like a suck down splint, right? So that at least it would have been not exposed. I avoided certain, obviously, citric foods, things of that nature, to avoid hot. I told them to not have hot.
So I'm going to tell you the best product in the world. I'll tell you the best product in the world. You cannot find CHX in my office.
Chlorhexidine?
You cannot find chlorhexidine in my office. In my other life, I owned part of a company called Novident in Israel. And we were the company that introduced subgingival irrigation. This is 20 years ago.
Wow.
And sub-G irrigation is extremely interesting, but you cannot get FDA approval for CHX for subgingival irrigation. And there's a product that we used to use called Therasol, which was invented by one of my patients, interestingly enough, for wound healing. But there is a product on the market it's in the US market now, and it's called Periactive. Periactive. It's made by Izun Pharmaceutical, IZUN Pharmaceutical. It's an Israeli company. It builds the autoimmune response of the tissue as well as kill bacteria. We're using it in patients who have mouth sores from cancer treatments. We're using with patients who have mucositis. The results are incredible. All my implant patients are on it. All of my hygiene patients are on it. The tissue response that you get is incredible.
Is it like magic
Periactive.
mouthwash?
Periactive.
Sorry?
The
Is it like
product.
magic mouthwash? Oh, go ahead.
So you're
Go ahead.
talking over each other.
Go
Go
ahead,
ahead.
Cheryl. Go ahead. Go ahead.
Is it magic mouthwash? Is it same as magic?
No,
mouthwash?
no. Magic mouthwash is one of the worst things you can possibly use because of lidocaine. Lidocaine toxicity is a very interesting thing. You have to be careful of it. If you want to see something that's a lot of fun, take some Hurricane or topical anesthetic and keeping applying it to the buccal fold of someone's mouth and see what happens. You can get tissue sloughing. So
It's like people use Emla, which you can't do.
exactly correct. It's toxic. It's toxic. So Periactive was invented by a periodontist in Israel who found the source of healing in plant-based products. It is a remarkable product. It's called Periactive. Remarkable product.
Okay, very good. Good information to know.
Magic mouthwash works really well for erosive lichen planus and stuff like that. You know.
Yeah, go to Periactive.
Okay. That's
Host,
interesting.
you travel to Israel sometime?
I used to go to Israel a lot. I have not been to Israel since COVID.
Right. My last trip was 2019.
It's an amazing place.
Yes.
I used to go often when I had my company there. But what's interesting is that we had a product called Perioflex, which was from subgingival irrigation that was distributed by Oral-B. And what happens is that when you do subgingival irrigation, the problem is that the neck of the gingiva heals, but the subgingival bacteria remains, and you get such good healing that you can get a periodontal abscess.
Yeah, of course. That's why you don't paradox. Same problem, right? You can do that.
Right. That's why you don't paradox. But not only that, do you know the reason that Procter & Gamble gave up CHX?
Not as effective, cost money, price, or no?
It's not that. Deep in the literature, have you ever seen has anyone ever told you that when they used CHX, they had cardiac issues?
Really?
In Europe, CHX is done in a much lower concentration than in the United States. You don't get black line disease from CHX at a low concentration. At a high concentration, you get bacterial shift. That's what the blackness is from, the black scuzz. You don't see that with Periactive. So we developed a program called
What's the main
Teeth for a
ingredient?
Lifetime. Look at the product. There's multiple ingredients. Just look at you won't regret it. You won't regret it. So we have in our practice what we call Teeth for a Lifetime. And talking about the business of dentistry, our hygiene department represents almost half of our production.
Wow.
So you need to empower your hygienists to be able to do what they need to do and do what's called client-centered dentistry, client-centered hygiene. There was a guy named Ken James. Ken James was a very, very famous dentist who died young, and he said, I personally net more than I produce. So if I produce $1 million, I make more than $1 million. How do you do that, Ken James? Because I have more hygienists than I know what to do with. Because Sally at the diner can afford to have her teeth cleaned, but she may not be able to afford a full mouth reconstruction.
Right.
So when you say more production, you mean is there more hygienists there, or are you actually doing something that's diversifying your services that contributes to the higher production?
Well, the thing is, we don't. I've laughed. when every hygiene guru says, well, you need to sell fluoride to all your adults, you need to do this, you need to do that, they get a bonus for this.
Laser.
No. Yeah, laser. No, the answer is we do lots of root planing, we do lots of root planing curettage, but it's really getting tissues to be healthy and having those patients who are healthy refer other patients.
Mhm.
You did mention 4 hygienists. Is that for 2 doctors?
There are days on Thursday mornings, there are 6 hygienists and there may be 1 doctor.
Oh my God. How do you treat patients with that?
Remember what I said about anesthetic time?
Yeah.
Also, that what happens is I check hygienists in groups. We don't wait till the end of the appointment. I may see a patient in the beginning of the appointment. There's a method to the madness. And so it's something that you need to learn how to manage. Now, when I'm doing a full mouth recon or I'm doing full mouth implants, I'm captured time. But generally, my time is not captured. It's a model it's not a model for everyone. It is not a model for everyone. But I was in a lecture with one of the most famous dentists in the United States that everyone knows. And he said, I will match my gross and net with anyone. And my buddy said, raise your hand. I said, no, I'm not raising my hand. It's his lecture. It's not my lecture. It's his lecture. But running 50% overhead is easy. When you have the ability, when you have a large office and you have very well-trained staff, if Mr. Jones today cracked tooth number 11 on a 3-unit bridge that was done out of Emax by someone else, I said, this bridge needs to be redone. He goes, I understand. Is there any way you can get it done today? Absolutely, because the answer is always yes. Dr. Hoos, can you cut off my arm and sew it to the top of my head? The answer is yes. But we have to talk about the ramifications of cutting off your arm and sewing it to the top of your head. Can you take out all my teeth and give me dentures? Of course I can take out all your teeth and give you dentures. Let's talk about what that means. So when he said to me, is there any way you can do this today? The answer is yes. So I turned to my dental assistant, Sam, and I said, Sam, he goes, I got it. She goes, Dr. Hoos, I've got it. When I came back in the room, the lower was scanned, the upper was scanned, a preliminary impression was taken to make his temporary. We used DMD impression materials. I like them very much. The 2 teeth were prepped. They were already prepped for crowns, right? 2 teeth were prepped in maybe 10 minutes. Score them, break them off, re-prep them. So 12 minutes. Blue velvet's used with Traxident. You take a blue velvet impression of your preps.
Yeah.
Sorry?
I love Traxident.
Yeah, Traxident's great. You take a blue velvet impression of your preps, you put Traxident in it, you have them close on it, you go do something else that you need to do, like insert an implant crown next door. That takes about 4 minutes to do. You come back, you rinse it off. The patient is scanned by the dental assistant. I use Luxacrown for my temporaries. Luxacrown is put in, come back, take it apart. Photographs are taken. He's told, you're going to be in the office for a while. I have all afternoon, Dr. Hoos, if you'll take care of this. He was in the office for 1 hour and 45 minutes. That added, now I don't know what you charge for crown fees in California. Let's say it's $1,000. That added $3,000 to the bottom line of the day.
Mhm.
But you have to have the physical plant to be able to do it. You have to have the staff to be able to have to do it. And you also have to want to be able to do it.
Right.
You have to want to be able to do it.
Absolutely.
Young guy was up all night last night. He was told, I was contacted by my service. Okay. He was told to be at the office at 8:30 in the morning. Do I have emergency time at 8:30 in the morning? Absolutely. There are 3 dental assistants there and 2 patients booked. That dental assistant's ready to go. He comes in, he's seen, an x-ray is taken, a cone beam is taken. Tommy, you need to have this tooth out. I know, Dr. Hughes, it's killing me. It's killing me. I so appreciate you seeing me. Tommy, you need to understand it is possible to save this tooth with a root canal. Dr. Hughes, how much is a root canal? $1,600. I can't do it. I can't do it. I just started at Amazon. I can't do it. I need to take this tooth out. I understand. But guess what, Tommy? Someday you're going to be able to have a dental implant here. So normally we graft these patients. How much is that? The extraction of the graft is $1,100. I just don't know how I can do that. I said, I understand. When's your birthday? My birthday is next week. Guess what? I already know when his birthday is. His birthday is next week. Tommy, we're going to take your tooth out for you. I'm going to give you a birthday present. What are you going to do? I said, we're going to graft this for you for no charge. For real? For real. Did I use Septicane? Absolutely. Septicane, broke, cut the tooth in half, luxate it out, bring the mesial to the distal to the mesial, okay? Degranulate the area, put in my bone graft. I like Dynablast. I don't know if you use Dynablast. I haven't liked Dynablast with some cytoplastic membrane over it. Use an X stitch on it. He came in for his suture removal today. He said to me, I can't tell you how many people I've told. That's practice building 101.
Customer experience is what that is.
Customer experience, practice building 101.
It's beautiful.
And engagement. You engage with them.
It is relationship
And
building.
related to him too. You saw
Right.
his need and you saw his pain and where he couldn't facilitate something.
And for 2 seconds, that's Jeff Hughes when he's 5 years old.
Yeah. What's beautiful is that you that one person, Jeff, made such an impact in your life. That one person changed your destiny and your career that affected all those other people from that one experience. So that one individual took the time to connect with you on a level that was understandable, relatable to you, and that changed your whole path. That's amazing, right?
If you Google Jeffery Hughes, if you Google Jeffery Hughes, why I do painless injections, you'll see an article that I wrote as a tribute to Irving Paul.
Wow.
He changed my life.
Dr. Jeff, it's been so honored to have you on the podcast today. And I wish we can have a longer conversation. But hopefully we can do another edition. But today is the perfect time for a call. I want to thank you and Dr. Jure for coming today. I want to have one question to ask you. If you were going to share some recommendation for a young dentist who just came out of dental school and want to become a better dentist, what are those suggestions that you recommend him or her to do?
So I will tell you that I do a tremendous amount of TMD therapy.
Yes.
I see at least 10 TMD patients a week. And my journey started with my wife, who was a TMD patient in dental school, and I couldn't find anyone to help her. So I hooked my horse to a cart of one person. And I learned everything I could from that person. Dr. Gelb was a pioneer in TMD. Gelb Appliances. Nobody was talking about him. I learned everything I could from him. And then I went to somebody else and I learned everything I could from them. And then I learned everything I could from them. And I developed my own techniques for figuring out how to treat TMD patients. And now I have physicians that send me patients. You must find a guru. You must find a mentor that you believe is giving you the factual information. Whether it be, you can pick any name you want, whether it's Kois, Strupp, Spear, Dawson, Cranham, Lee Culp, Larry Rosenthal, David Hornbrook, Jeffrey Hoos. Don't listen to me because I don't know what I'm doing. But the truth of the matter is, you find out what they're doing. And when they tell you something that doesn't make sense to you, you figure it out. So when I say you can give painless injections with no topical, and people tell me I'm nuts, I would be willing to bet almost any amount of money to prove it to them, because I'm doing it. And if someone says, when I started, there was a guy named Bob Lavoie, the $100,000 practice. I'm going to tell you something. $100,000 practice is nothing. $100,000 weeks, yes. $100,000 weeks. The point is, you have to learn how to do this, but you have to be willing to learn how to do it. I learned my implantology from 4 people: Rosenthal, Schnittman, Mish, Cranham. I don't use their techniques, I use my techniques. The young dentist has to hook their wagon to somebody and learn
Absolutely.
from them.
Absolutely.
And also, you find the smartest kid in the room, that's who you want to partner with. You want to find a dentist that you want. Dentists come to my office all the time to be with me.
Mm-hmm.
Come on aboard. Come on, I'll show you. Find someone in your town that's a good person. They're willing to show you. We are in the best healing arts in the world. But you know the trick is? It's about finding the balance.
Absolutely.
Art, science, and business.
Thank
I
you.
think Peggy-
It was lovely meeting both of
Peggy
you.
teaches that philosophy.
Thank you so much, Dr.
Beautiful.
Jeffrey Host. I hope to see you guys next time. Thank you again.
Thank you so much for your
again.
time, Jeffrey. Yeah, pleasure, honor, privilege.
Bye-bye now.
Thank you so much.
We can join another
Yeah.
Zoom if you have time, but I'm not sure you are. All right.
Yeah, I'm going to go to the other meeting. Jeffrey, I sent it to you. Did you get it?
I will check and see.
Oh,
You
by the
can-
way, it's Almost. Steve Almost is the name for the TMJ guy. You know him probably, right?
What is it?
Steve Almost.
I actually don't know him.
You don't know him? He's
Could you
international.
send me, could you send me his information or?
Yeah, he's got a website. He's got